This is Abolishing Nail Biting by Polishing Nails by Emily Feldberg. Introduction, slides 3 through 6. So you may ask, why should someone stop biting their nails? Well, let's dive into this to answer this question. Nail biting is also known as onychophagia. It is a negative behavior that is prevalent in our society. This condition can range quite drastically from mild cases to more severe cases in which the person scars their fingers as well as their skin around their fingers. In one study done in February 2012, and it was published in the Journal of Nervous and Mental Disease, was about a man who was 66 years old who used to be a severe nail biter. Well, after enduring some trauma and other variables, he ended up self-mutilating his fingers. So this is an extreme side of this behavior, but they did hypothesize that this was in relation to his original nail biting behavior. People who bite their nails are also represented across all age groups, but is especially prevalent in children and adolescents, estimating affecting up to 45% of them. In children and adolescents, it may cause some anxiety or self-conscious bullying, something like that, if there is observable damage to the fingers and hands. And in adults, it can also cause some self-consciousness especially if their hands are seen by public when they're out in the professional world or even out shopping. Biting your fingernails also introduces the body to germs. It damages the fingers and nails beds, which we touched on, as well as causing inflammation or bleeding, as I said. It has also been documented that teeth may have a bit of wear and tear on them, so that's another consideration to make. So treatment is important for those who are interested in stopping this behavior. And why not, especially if the treatment is low cost and convenient to use? We'll touch bases on some past treatments and their positives and negatives, and then we'll get into my proposed treatment to combat nail biting. Other treatments that people use are aversive bitter flavoring. It's favored because it's cost effective, it's quite cheap. A side effect, though, of this is the aversive flavoring can transfer onto unintended objects, and it also requires reapplication to be effective. One of the first behavioral interventions are habit reversal training. This is when the person is coached in order to break their habit. It is long-lasting, but it does require time-consuming and consistency to get it under control. Finally, we have our non-removable wristband. And this was in 2011 by Koretsky and Yechem. Hopefully I pronounced that right. They found success in it. It was done by designating the wristbands as a representation as the patient's resolution to refrain from biting their nails, and it reminds them of it. During their study, the participants were instructed to not remove the wristband or they would be dismissed from the study. It removed the need for reapplication, and of course it gave the participants a visual reminder too. A complaint, though, is that it can also be bulky, so that is just another consideration when we're trying other treatments. So let's talk about my study. So this treatment, we will be using the gel nail polish as our manipulated independent variable. Some positives are it acts as a visual reminder that is durable. The durability has been making the gel nail polish more popular. It also doesn't require training, which the HRT technique did. So that appeals to people who don't want to invest a lot of time into it. It's available in many colors as well as clear. So this is positive for many of the participants. They get to choose different colors. And for males, they also get to choose clear if they would like to not draw attention to their fingers. It's a relatively inexpensive price. And the nail polish isn't a fake nail, but it does leave a hard coating across the nail top, so it may leave an aversive feeling on the teeth if a person chomps down onto it. Some negatives of this treatment were possible side effect of nail thinning. A study was carried out in 2012 that examined the nails of 5 women after they complained that nail polish was causing their nails to thin. During this time, researchers used ultrasound and reflectance confocal microscopy, RCM, to measure changes to the fingernails. The results in the study found that the nail thickness decreased after the removal of the gel nail polish. Researchers hypothesized that this is due to the application as well as removal process of the polish, which may decrease the nail integrity. They couldn't tell, though, if it was from the actual nail polish or from the removal process, because the removal process uses acetone, so they weren't able to see which one exactly was causing it. Another possible weakness of this study, though, is allergy, because some people may have allergies to the nail polish. It is also not permanent like the wristband, so it does have the possibility of chipping, though it should last around 3 weeks. And then there might be a gender bias, because gender selection bias, because males don't normally use nail polish and may not wish to participate in that. But of course, we do have the clear as an option. Method, which includes slides 8 through 11. Our participants were college students. They were recruited with an advertisement offering students a no-cost way to decrease their undesirable behavior of nail biting. There was a total number of blank participants, blank female and blank male, all who attended college. Ages ranged from blank to blank, with a mean average age of blank. And they all signed an informed consent prior to starting, and then each was assigned a number as a form of identification to keep their confidentiality and privacy. How were the participants assessed on their behavior as well as assigned into groups? The participants completed a survey that was adapted from the Massachusetts General Hospital hair pulling scale. It was also used by Moritz in 2011. It was used to assess the severity and frequency of their nail biting behavior. Moritz chose to use this adapted scale because it showed internal consistency and retest reliability as excellent in trichotillomania, which is the hair pulling disorder studies. So they only adapted the nail biting from the hair pulling. So it just, instead of having hair pulling, it just showed nail biting in that questionnaire. Participants were then assigned to groups based on their scores. Group placement was done to promote organization of varying degrees of the reported habit. All participants received the same intervention, though, at different times, which we'll get into that later. So group 1 was score 0 to 7 points, group 2 8 to 14 points, group 3 15 to 21 points, group 4 22 to 28 points. We just wanted to track this as well as organize it, so then we could tell if the treatment was more successful through groups who were scoring lower or higher in points. So just another option to track. Design and procedure. Definition of nail biting is inserting the fingers into the mouth and the teeth then contacting the nail. This is done instead of using nail trimmers or nail scissors. Nail condition will be documented by measuring the participant's nail length in millimeters, observing rough, torn edges, and or any observable damage from the distal phalange up. Fingers are then to be photographed to document before, during, and after treatment pictures. Additionally, the participants will be asked to report any occurrence of the behavior of nail biting during the study. This data measurement technique is like the past study conducted by Dufresne and colleagues in 2008, which baseline total nail length was measured at the beginning of treatment session, and nail length was remeasured at the beginning of each treatment session. Once the intervention was introduced, treatment sessions occurred across successive weeks on the same day at 2 p.m. Participants will not need to have the nail polish removed prior to the measurement because the polish does not extend over the edge of the nail. So this will not cause any miscalculation on their nail length. During Dufresne and colleagues' study, They only used one participant, so our study will be using multiple participants who identified as nail biters to increase the external validity of the study. And the pictures included on the left are of what would be happening during the study. It's, of course, not actual pictures because we weren't allowed to conduct it yet. More in-depth information on the study, the manipulated independent variable is gel nail polish, and the dependent variable is nail biting. And the independent variable was selected by the participant and then applied to their nails by a certified nail technician at a designated location used for the data collection during the study. This research experiment will be using a multiple baseline across subjects design. So this is if the behavior change is observed only after the intervention is presented throughout the participant pool. This will help support the idea that this change was caused from the independent variable that we chose rather than any additional extraneous variables or by chance. The dependent variable, like I said, is the nail biting. It's assessed by measuring the length of the nails, pictures, and the self-behavioral report. These are the results that I would like to hit on in the future if I ever conducted this study. Was there a change measured in each group after the intervention was administered? What was the degree of change? Did the behavior decrease, increase, or stay the same? Were there any additional extraneous variables that showed up during this time? And what was the participant dropout rate as well as the retention rate too? So in the future for the discussion, I would like to touch bases on the internal validity, which is if I could truly link my manipulated independent variable to my dependent variable to see if they were the causal change was caused by it. The external validity, which is generalizing to the population. So I know with this type of independent variable with the nail polish, it may be best to do a pilot test on it before actually trying to do the study, just to see if there are only women who are trying to come in here, just because of that bias of men not wanting to wear nail polish. Implications of this, I really am not sure. I guess that if this was a true successful thing, then they may see a rate increase for wanting to choose purchase more nail polish. So I hope that's what that means. Future research, I think it should be done with a larger patient pool, just because that just helps give you better estimations and statistics. And I would like to see if I could somehow include an inter-row observer in here so we could have a observer agreement just to see what scale that is. And I wasn't sure how I could fit that in there. So I think that would be something good for future research. So here are my pages for my references. I just want to tell you guys that the last one, Moritz, is where they attach the file of the adapted questionnaire. So that's available there. Otherwise, I so appreciate everyone listening to my video. So thank you guys, and I hope you all have a wonderful Thanksgiving. So have a wonderful Thanksgiving and good luck on finals. Bye-bye.